Hey everyone, Dr. Gary here from City Facial Plastics in New York City. I'm a double board certified facial plastic surgeon. One of our subscribers left a comment and suggested that I do a reaction to this video. This is by Jackie from NerdECrafter. I've honestly never seen her stuff before. I guess she's into like arts and crafts and opening up different kits and working with them. I hear she's very talented, and she recently did a video on trying surgery for the first time with a cheap medical kit.
Today we're going to be trying suturing kit.
Oh, look at this. The guy in the suture kit, he's bald just like me.
We're going to perform minor surgery. Oh, why do I do these things?
Just a comment on the bald guy on this kit is that he's got a stethoscope around his neck. Back when I was an intern in residency at Temple Hospital, there was a cardiothoracic surgeon who told me that when I was wearing a stethoscope around my neck, they called it a flea collar, and he ripped it off and he said, "Surgeons don't wear that around their necks."
I mean, it can't be much more difficult than actually sewing clothing, right?
Well, remember, it's a little different when there's no blood around.
Here is the thing I am most excited about, which is the fake skin. Oh my god. Oh, that is solid. Oh, that is weird. Oh, yeah, that feels very
probably some kind of a silicone.
Like, all right, let's play around with these scissor things.
That's not a scissor. That's a needle holder. That's what you use to hold the actual needle that you drive into the skin.
It has these hooky things that you could just use and decide how it holds.
In clinical practice, that mechanism is very important because if it locks too tight and it's difficult to open, you get a lot of hand fatigue over time.
This is a little bit more of a bent type.
Just to give you guys a sense of price, like a really good needle holder and a really good scissor can each run you like 250 bucks.
I'm calling them scissors, but they're not really scissors, I'm sure. Stop yelling at me through the screen. I can hear you all the way to Canada. Stop. I know.
They're not.
I know I'm messing this up, but I'm learning. I'm going to condense 7 years of medical school into a 30-minute video.
Medical school is not 7 years. It is generally 4 years, but she might be talking about like the combined programs or the combined bachelor programs with medical school. And then there's residency, right? So I personally did 5 years of residency after 4 years of medical school, and then another year of fellowship after that.
Now these, I'm pretty sure, are actually scissors. Look, there's no hooky things. And it goes.
That's a straight iris. They also come as a curved type of instrument.
I pulled up the introduction video to this kit, which is a different doctor. At least it seems so. From this guy over here, who seems like he would just not listen to what you were saying anyways. So this guy already looks somewhat friendlier. Let's see what he has to say.
Hello everyone, my name is Dr. Mario Ademai, and today I'm going to be your instructor in the How to Suture course.
Very nice.
I don't know.
So we're actually going to get a whole course. That's good value for only $50.
I don't know if he just finished training,
come in handy
what
during
kind
the
of
zombie
doctor he
apocalypse.
is. Who knows?
These suturing kits have everything you need inside.
Did he just say includes everything you need?
What about the gloves?
Includes everything you need.
Which so far it seems
I
so.
mean, Jackie brought up a good point.
If you are a doctor watching this, I am sorry, but I've just had bad experience, so I'm 100% projecting. Maybe you're not like that.
Oh my gosh. Don't be mean, Jackie. So this guy has gloves on. They just forgot to include it in the kit.
Now, one of the things Mario didn't say is to disinfect the area, so I guess we're going to go under the assumption that it's already disinfected. So let's go ahead and start with a gash that's simple. Oh my god.
Well, not just disinfected, but ideally it would be numb as well.
Basically, with the T-Rex things, we go poke it.
Look at how much force Jackie is applying with her left hand as she's gripping the skin. Too much. You can see the skin elevating. It's almost like this fake skin is changing colors, and real human flesh you can sometimes see blanching, where you get this like whitish appearance because you're squeezing all the blood out of that area. And you can see that right hand, that the way that the needle holder is set on the needle, it's way too far over and then it's too close to the suture tail, so she doesn't have enough control over the needle edge as she ideally would. And I don't think that she's entering at a perpendicular angle. It looks like she's skiving a little bit, which is a tendency when people are learning how to suture. It's much more difficult to enter perpendicular because it feels like your needle is going to dive too deep. But with the right size needle, it works out fine.
Oh, I have goosebumps. Oh, my heart. Oh,
Why, Jackie?
Oh, I don't like
What's wrong?
So
There's no
that,
blood.
I'm really glad I did not listen to you to become a doctor because I'd be fainting right now.
I think she could do it
We're gonna go
with
right
enough
across.
practice.
It's interesting because I can see the needle somewhat transparent under the skin here. Look at that. Actually, let me zoom in, and there's a little bit of transparency right
Nice
here.
camera.
Just grab the skin and poke right through. So I can basically see where it's going. This technique is really good. Mario, you are a great instructor.
So like she's still holding the skin, but like let go. You don't need to keep holding it.
This is so long. Ah, come on. You can see the thread is still moving there, and my arm is just going so far. Okay, there we go. We got it.
And that's a super long thread.
We're going to learn how to make a surgeon's knot.
First, start by driving the needle in. Try to go perpendicular to the skin.
So you can see Mario's a little bit more gentle with how he's gripping the fake skin with his left hand. But I would argue that like in this shot here, you can just let go. You don't need to keep holding with that skin with your left hand. Just let go at this point, grab it with your right hand, and keep going.
Smooth bite towards the other side. Pull the needle out, and then pull the string.
The other thing is that when you enter the skin, you don't want to be too far from the skin edge. You have less control over the closure. There's less opportunity for eversion. So you want to be a little bit closer to the skin edge. So I would advise bringing your bite in closer. So not taking your bite from, say, he's probably close to a centimeter away from the edge of the wound. I would take it in much closer, maybe 3-4 millimeters away from the wound edge.
Pull the string all the way until you have a short side and a long side. Wrap around twice for a surgeon's knot. Then pull the short end and then pull your hands on opposite sides.
You don't always need a surgeon's knot with the second loop, but he is correct, that is a surgeon's knot.
According to the video, I'm going to make 2 loopies. 1 loopy, 2 loopy, and then grab this wire here. Okay, got it.
So notice how when she's grabbing the short edge, she's not grabbing at the tip of it. She's grabbing somewhere much lower down, and that's going to again decrease her ability to control the suture. So you'll see how much she struggles here, and there's going to be redundancy of suture and random loops happening instead of like a clean pass.
Pull, 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 pull. Oh, hang on, hang on. We have a loop. Okay. Yes! And here is our first knot. That is so cool.
Instrument, and then grab the short end, and then pull your hands again towards opposite sides. Always pull your hands toward the opposite sides.
In clinical medicine, we don't always do that, and it's partly for efficiency. It's partly because sometimes if you're pulling the opposite way, if you have second surgeon working with you, you can get in their way. It gets into kind of more detailed of a discussion here, but let's just say that sometimes it's okay to pull towards you and to not do a surgeon's knot. It just depends on the specific situation.
The way to do the cutting, once you have the strings in your hand, is you want to go and then angulate a little bit. Once you get the scissors in, you want to angulate a little bit because that'll give you a little bit of room so that you don't cut the strings too short.
He's right about that. Usually though, you have an assistant who's cutting the knots for you.
All right, so now that we have the main one here, we're gonna do it again. So we do 1 twirly like this, grab the wire, and
she just got this extra loop because she grabbed down here and not at the tip.
how did he not make a loop? There's 1. Here's another.
She missed that technicality because Mario didn't describe it, but you gotta keep your tail, the short tail short, and you gotta grab at that tip.
There we go. Now we have 2. That is a mess.
But it's not
No, that
tightly
is not gonna heal
positioned.
well. You're gonna need
No.
polysporin.
Polysporin.
Okay.
We recommend polysporin after wound closure, even on a nicely closed wound, usually for a week or so.
Obviously, this is not done right. So for those of you who want to say,
Jackie, it needs to be tighter. You're doing it wrong.
I agree, it is wrong because it's not supposed to be like this. So yeah, there's definitely too much gap. A little further
Ooh,
up.
she's really
Oh, too
diving
far.
deep.
Oh, no. Okay, yeah, that is way too far. We're not going there. Hang on. I'm sorry, person. I think right here is about a good distance. Okay, there we go. And the good thing about this
That's
is
still
your
too
patient
far,
is
but-
sleeping for the most part.
No, actually, most of the suturing that I do these days are on awake patients who are just have local anesthesia in place.
We're gonna do the 2 knots. 1 wrappy, 2
See, again,
wrappy,
Jackie,
and
you gotta shorten it. Okay, so
Very
you see,
nice. That
that's
looks
why
good.
she had an
I'm
easier
pretty sure I
time, because she shortened that short side of the suture.
We're going to use a different kind of stitch, according to Dr. Mario, is called a running stitch. It's basically the same concept as the individual ones that we've done so far, except we don't stop. We keep going from one end to the other and then knot it up.
So the original one that she was doing was called simple interrupted type of suture. Now they're going to be doing a running suture. The advantages of running a suture, especially in like a baseball stitch type of way, is that it's just faster to do instead of stopping and doing each individual one. The disadvantage is that you're basically going to shorten the wound. There's going to be some degree of shortening, and that isn't a big deal in most places of the body, but when you're working on the face, a little bit of shortening can sometimes be a problem, and you have less control over each little aspect of the wound compared to doing it one by one. So there's pros and cons to running versus doing simple interrupteds.
But he does explain that the bad thing about it is if you lose at any point, if the wire snaps, you have to start all over. So that's the downside.
That is another downside.
I guess we'll find out. Which means time for ketchup. Let's see how I can avoid getting my hands dirty with the ketchup in the wound.
Okay, so it is gonna simulate a little blood.
We're gonna put some ketchup right in there, because I mean, come on, we need to be as realistic as we possibly can. I am a professional doctor and I know exactly what I'm doing. There we go. Oh, I think
Ketchup is orange. Isn't it supposed to be red?
Okay, there's a little bit of extra ketchup. Let me just do this here. I like ketchup. Okay, let me squeeze a little bit of that out. And I think we're ready. Since I have no idea what the differences are with the sutures,
blood is never so easy to work with.
I'm going to take the orange one, because it seems to be the most waterproof, and we do have our ketchup nicely in there.
Even dissolvable sutures don't dissolve that fast, not instantly.
I am not made for doctor things. All right.
So we actually sent out an email to Jackie that she responded to, inviting her to do an epistaxis, which is a nosebleed type of simulator, something that residents are learning how to control a nosebleed. So I thought it would be exciting and interesting to walk Jackie through the process and see how she does with that type of simulator. So she seemed somewhat interested, and so we'll see where that goes. But if you guys want to see that, if you want Jackie to maybe even come to our office here in New York City, or we can try to do it remotely, but I think it'd be more fun to have her here, make sure to message her and let her know that you want to see that video.
Get some nice clean ones. Just so you grains know, I'm trying to do this through a screen. The other sutures that I did well were actually without the screen. So, okay, let's keep going. Let's keep going.
So she's not holding anything in her left hand. It'd be good if she had a little forceps to help brace the skin. She forgot about that part.
Our surgeon's knot, and then grab from the edge.
Yes. See, she's improved. She's grabbing from the edge.
There you go.
Nice. Not too tight.
And let's make a couple of knots.
Not too tight, Jackie.
Say about 4 to 5, so let's keep going. Voila. And you know what? The ketchup hasn't reacted yet. Pretty sure that's not how it works, realistically speaking. Or maybe it does. I don't know. Does it just flow freely? I don't know.
Bleeding? Yeah, blood.
Right, let me
blood
make the
does
other
just
3
flow.
or 4 knots over here. And now we angulate and...
So is she gonna run it?
Okay, no, I'm not supposed to do that.
One of them.
Do that only to the short one over here.
Yeah, or else you can't run it.
Oh my god, I almost really messed that up. We're supposed to continue sewing all the way. Oh
Keep going, Jackie.
I seriously almost done messed up.
You done messed up, Aaron!
Alright, so from here, it's basically just taking even little bites. Well, not little, but even bites. That ketchup.
Where is her forceps? She like
I'm
forgot
not having this.
about the
This whole
forceps.
ketchup situation is just not
She's just like
great. Believe it or not, it's
holding
actually
the skin
making
with
me
her
nervous.
fingers, which sometimes we do, but
And
that's a little bit more of an advanced move. I'd like to see her
that is
using her
hilarious. I am
ass
way
and
more
forceps.
nervous with the ketchup being there than with it not being there. Holy carp. Okay, like this. Voila. Very nice. And the doctor did say to keep a tension as we're going. So I kind of have to keep my hand holding over there as I'm putting the next one in.
Yeah, you could do it that way, or after you can still use a forceps in your left hand, and after you've thrown a few, just basically tighten a little bit, or you can have an assistant hold some tension on it for you.
Oh my god. Oh my god. I got you. There. Good. We're keeping tension.
So she's doing a running locking
we're doing
suture
good.
here. You see how she's locking it. She's not letting it kind of go freely. When you do a running locking suture, you're increasing the amount of tension on the wound edge, which if you have more of an open kind of wound and you're concerned about it opening up, you could use that technique, but the disadvantage is that it does create a lot more tension on the wound edge, which isn't ideal. Most of your tension should be on the deep sutures, which is what I was kind of referring to earlier. The skin closure should be ideally tension free. And so when you're putting that kind of increased tension on with the running suture, with the running locking suture rather, it's not ideal in most situations.
We are nearing the end here, and I don't know
Well,
what do
she can
doctors
just wipe
use
it.
to wipe off human ketchup.
We use gauze or sponges.
Do they use paper towels like I'm using right now? Or
No.
are they
So let's see if she knows how to close it
Here
up.
I am using paper towels. Oh my gosh. This is Frankenstein's monster here. And let's get that edge. Whoops. That was no good. You didn't see it. And grab this and pull through. Oh, my
Oh, jeez. Oh, no.
yes.
Oh, look
Okay,
at her.
wrap this up. Let me do 5 more knots so that it's
Nice
secure.
job,
And now we
Jackie.
angulate and snip. Voila.
Not bad for a beginner. So this was a great video on trying surgery for the first time with cheap medical kit. Hopefully you enjoyed my feedback, commentaries on Jackie's experience. And if you did, please make sure to check out our do-it-yourself filler video reaction that I did on kind of a crazy community that likes to inject their own faces with filler. Click on the card to learn more about the DIY community, and I'll see you in that video.